Thanks for joining us for this COVID-19 and City News Briefing for Wednesday, November 18th. We will start with testing numbers from all of our healthcare organizations. As of this morning, 85,660 tests have been conducted, with 9,305 of those back positive, 75,655 negative. We have 700 tests currently pending system-wide. Between Merit Health, Wesley, and Forest General, we have 62 people who are in the hospital with COVID right now, which is 6 over where we've been for the last 2 weeks, with another 1 under investigation. And of those 62, 16 are in the ICU, which is actually 6 under where we've been for the last 14 days. As you can see, we've hit the low 60s over the weekend. We've kind of continued to stay there. Both hospitals, we'll talk about this in a second. We are glad to see, however, ICU admissions fall down under 20. Statewide today, I think this is the 7th highest case number of new positive cases since this began, with 1,593 in terms of new cases, 20 new deaths, and unfortunately, one of those new deaths was in Lamar County. We send our well wishes and condolences to that family. Totals to date, Forest County has 85 deaths, Lamar County has 48. New positive cases today, Forest County had 30 new positives, Lamar County had 17, so almost 50 in the metro area. Since this began, Forest County just under 3,500, Lamar County at 2,630. Our 5-day average, Lamar County continues to bring its number down to just over 10. Forest County, however, we're up to about 25 new positive cases per day over the last 5 days. The inside 14-day number, again, this is the number of people who have received their positive test result within the last 2 weeks. It gives you an idea of how many potential active cases you have in your community. In Forest County, that number stands at 294, and in Lamar County, that number is at 204. Forest County has greatly outpaced Lamar County over this past week, and so the number of active cases just under 300 now. And if you compare week over week, this is a pretty startling figure that should give us all some concern. A week ago, there were only 189 cases inside 14 days, again, active cases. Today, it's 294, so an increase of over 100 only within 7 days. Lamar County brought its total down by 14, so knocking on the door of 500 again in terms of total active cases in our metro area. A lot of that increase in Forest County, according to emergency management, has been driven by the south part of the county as well as the greater Petal area. We are also seeing, again, some outbreaks among our universities. Southern Miss has about 20 active cases. William Carey has about 10. So the end of their semester and trimester coming soon is probably a welcome sign for us. Hospitalizations, again, we jumped over 60 over the weekend, so 7 over where we were last Wednesday. ICU admissions, however, are down. Our goals continue to be protecting the vulnerable, people over the age of 60 or people with underlying or chronic health conditions. Second goal, we'll talk about more in just a second, is preventing overrun of the healthcare system by slowing the spread. And if we can do both of those two things, we continue prioritizing public health while keeping the private sector open and operating. 4 things that we lean on: widespread availability of testing, wearing masks, watching our own data, and listening to all voices. Part of listening to all voices is our weekly conference call. We've been doing these calls with our stakeholders, hospitals, emergency management, schools, elected officials, universities, since March. And so every Wednesday we kind of get together and share this data that's going on right now. And there are 2 things we hit on today. Is one, outpatient testing trends, and secondly, hospital capacity. And so we'll start with testing trends. We hit on some of these last week, and I'll just kind of give you a quick snapshot. As you can imagine, with new positive cases, positivity rate's up. That's the percentage of total tests that have come back positive. And so last week was one of the higher weeks we've seen in the last couple of months at 12.8%. This week we're at 10.95%. We have 348 tests currently pending. This is Hattiesburg Clinic outpatient testing. And so that positivity rate is likely to go up even more. The average age of new positives continues. Of course, when we had the spike in early October, most of that was driven by high school and college students. As you can see, the average age has gone up since then, just under 43 right now. And if you look at the next slide here, this is the percentage of those new cases that are under the age of 20. Again, early October, almost a third of all the new cases were under the age of 20, and so we didn't see those kind of increases translate into hospitalization increases. However, as your average age goes up, and as the percentage of new cases under 20 go down because they're not going to have the same negative reaction typically as your older folks do. You're seeing that translate into higher hospitalizations. So let's talk about hospital capacity. I know that this has been in a lot of news stories, both in statewide media and local media, and I just want to tell you kind of what goes into that. The first thing is you got to have space, and so both of our hospitals have a certain number of licensed beds, but of those licensed beds, they may only have a certain number of staffed beds, and so for example, when you talk about staffing a ICU room, you may need one nurse can maybe handle 2 patients, or in a regular acute floor, just a regular hospital floor, one nurse may cover maybe 6 patients. But when you're dealing with a COVID-related patient, it takes one nurse that number of patients they can treat goes down to like 4. And so you also have to factor in that when you're talking about staffing, they have to also consider our employees getting sick, which takes more people off the line to take care of folks. And then finally, just stuff, as we'll call it, therapeutics, blood supply, ventilators, that kind of thing. That also goes into determining where we are with capacity. It's also important to know that hospital capacity changes throughout the day. As of this morning, for example, Forest General had out of their number of acute beds that were not designated for orthopedic or postpartum, they were about full. And their ICU was about full. Marriott Health Wesley had a handful of beds available, but their ICU, they were actually 2 over capacity. However, over the course of a morning on a typical day, you see a lot of people discharged. Just that's the regular flow of a hospital's census. And so at 2 p.m. today, we called back and said, well, how many? What's your capacity right now? And so acute beds as of 2 p.m. again. Forest General may discharge 80, 100, 120 patients a day, and so they actually had, at 2 o'clock, they had 34 beds available in terms of acute care. Marriott Health Wesley had 12, but it's also important to know that when as the afternoon goes on, peak time for admissions for hospitals is usually 3 to 5 p.m., and so the number of beds you see available right now won't be there by 5 p.m. today, and so again, it changes throughout the day. The ICU bed story, though, is something that we need to pay particular attention to. So Forest General is at capacity right now in terms of ICU beds. Now, if they're going to take care of whoever comes in July, they had to expand their ICU capacity by 10 just to get through that spike. Marriott Health Wesley is already 2 over capacity with the potential to add up to 8 more ICU beds. And so in terms of the most critical patients, we're in a tough spot right now. And so that means that all those things that we talk about doing collectively as we set policy, but also to you individually, wearing a mask, practicing social distancing, avoiding large crowds keeps you from getting it and keeps you from spreading it to people who might be vulnerable, who end up in the hospital, who put a strain on our hospital capacity. Of the people we have in the hospital right now, those 62 hospitalizations, roughly a third of those are from our metro area, 15 from Forest County and 6 from Lamar County. Which goes to the point that the Forest General Hospital, Marriott Health Wesley, they serve 18, 19 counties. And so when people get sick, or if other hospitals, smaller hospitals, are at their capacity, they're going to send those patients to us. And as you can see in other places in the state, they're already at capacity. And so the more that we make good decisions, the more that we can keep this problem from getting worse. One bit of good news is because of higher flu vaccinations and also people just wearing masks, there are fewer flu cases coming into the hospital. That's been sort of a saving grace in all of these the capacity issues that we've had, is that fewer people are getting the flu because they're getting vaccinated and they're wearing a mask. Some testing opportunities we want to let you know about. Of course, Cough and Fever Clinic. All of Marriott Health Wesley's outpatient clinics are there. C.E. Roy Community Center is there a couple times a week. But we want you to know the health department at their office in Forest County at the 42 bypass and 49, they're doing drive-through testing this week, Monday, Wednesday, Friday, and rapid tests are available. In the Lamar County Health Department, which is in Purvis near their courthouse, are doing rapid tests and drive-through testing Tuesday and Thursday. Also, as you make Thanksgiving plans, and Forest County Emergency Management is specifically doing this because they know that people are making Thanksgiving plans. If you need a mask, there's a giveaway this Friday and next Monday. So this Friday from 7:30 to 4:30 at the Forest County EOC office on Highway 11, and then Monday from 7 to 7 at that office as well. If you know someone who is disabled or shut in, they can call 544-5911 and one will be taken to them. again, we encourage you as you make your Thanksgiving plans to make wise decisions. Some city news. Paving continued earlier this week, finished up on Claiborne Avenue and Cary Court. That's in Ward 2, and part of that Claiborne is in Ward 5. We're glad to see those getting wrapped up. We also want to let parents and grandparents and other stakeholders know from Hattiesburg Public Schools, our school district's done a really good job of trying to set policy to protect students and their families. With that said, there was a bit of an outbreak last week, particularly in middle school and high school. And so the week after Thanksgiving, in an effort to try and get ahead of the wave and try to prevent this from getting worse, the week after Thanksgiving, all middle school and high school classes will be virtual only in Hattiesburg Public School District. Elementary school we've been okay, but high school and middle school will be virtual only that November 30th through December 4th, and they'll monitor the data from now until then to see if that needs to go another week. Finally, our act of courage. We talk a lot about hospital capacity, and I can tell you that nothing would be possible without the incredible dedicated work of our healthcare professionals. These folks have had to deal with this pandemic for 8 months now. Many of them have contracted COVID themselves and have to deal with trying to keep themselves and their families safe while also showing up to work every day and taking care of people in again, a very tough season. And so we salute all of our healthcare workers at all of our healthcare institutions, whether Hattiesburg Clinic, Merit Health Wesley, Simri, Forest General, Moffitt Health Center, the health department. Thank you for what you do. And again, if you see one of these health professionals out, say hello and thank you from a safe distance. As we continue the week, remember to wash your hands, take care of yourself mentally, physically, wear a mask if you go out in public, do only what is essential, and remember, you're safer at home. Have a great rest of the evening.